Okay, keys to success number 96 today. I'm Dr. Martin Rutherford, certified functional medicine practitioner and chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
What we've been doing for the last 8 or 9 or 10 weeks is going back and reviewing and repeating certain keys to success that we feel are important to keep you on track. A lot of our focus right now in our understanding of what we do is being pointed towards helping you to stay better. And we're going to be doing a hangout after we finish this up on Hashimoto's. And Hashimoto's is a significant factor in our practice. In fact, I would say probably 80% of our patients,
it's pretty high, yeah,
have tested positive for Hashimoto's. And if you want to know how crazy that is, you can listen to our hangout in a little bit. But Hashimoto's is significant, and what we're going to talk about is why you need to be careful with the lab ranges and results, especially when it comes to Hashimoto's. A lot of you are going to medical doctors, GPs. A lot of you are have Hashimoto's, and maybe you're out there a year or 2 or 3 or something like that, and then maybe you go to your doctor. Maybe all the things we talked about here relative to the uniqueness of Hashimoto's lab ranges are not clearly in your mind. And the doctor then says, oh, you're way off here, and this means that we got to do this with your medication, or we got to change your medication, or we do things like that. And there's a lot of nuances that go along with reading lab ranges that even your doctors are not yet conversant with. So it's something that could really throw you off track. So Hashimoto's and the lab ranges and what to be careful of, probably some even new nuances since we did this, because this is 34, so this was almost a year and a half ago, or 2 years, year and a half ago, or something like that. Mm-hmm. So maybe we can bring some of the more clarity that we have to this for the patients who are out there.
Okay. So as a patient, you probably have this faith in the system, like a lot of people have faith in the government, that there's one unifying accepted standard for diagnosing a lot of conditions, or diagnosing Hashimoto's thyroiditis. The problem is that's really not the case. One example would be cholesterol. For example, the high value for cholesterol used to be 300, or it was 270.
It was 270 when I was in school.
When you were in school.
Yep.
So now the high value is 200. And there's even some talk that we should even almost abandon the 200 marker and just go to 150, or just prescribe statins, which are cholesterol lowering medications if someone has any potential risk factor, like they have poor diet, or they're overweight, or they have previous cardiovascular disease, or diabetes, on and on and on. So these lab values are constantly coming under criticism, and there's not always a unifying agreement as to what is normal and what is abnormal. No case better illustrates that than the autoimmune thyroid disease marker, which is called the thyroid peroxidase antibody. It used to be known as the microsomal antibody. Another antibody used to test to see if your immune system is killing your thyroid is the antithyroglobulin antibody. And we have patients coming from all over the world, so we have the privilege to see what the thyroid markers are in Europe versus Australia versus here in the US and different parts of the US. So even when I got into practice, this is almost 8 years ago, the high value for the thyroid peroxidase antibody was about 100. UCSF, if I remember correctly, was using 100. Then we saw the values go to 60, then 50, then 34. LabCorp has maintained 34, while the local hospital here, Reno, the biggest hospital in the area, they say anything over 9 is too high. We've seen a lot of labs in California say anything over 9 is too high. And probably bringing even more credibility to the issue is the Mayo Clinic. Their unifying standard is anything over 9 is too high.
But the point being, there are still varying ranges all over the country. And if somebody in a lab says your lab range is 0 to 34, they're still going to tell you that you don't have Hashimoto's.
Right.
If you're in that range of 10 to 34 or 9 to 34, they're going to tell you don't have Hashimoto's, even though the Mayo Clinic says now that you do. And St. Mary said that it was 9 And now they say it's 32.
All right.
And we may have had something to do with that, which is not, it's kind of weird. Anyway.
Yeah. Well, anyways, and then our patients coming from Europe, now we're seeing anything over 5 or 6.
Yeah, 5 in England.
Yeah, 5.5. I've seen that. 6, and I think it was in France. So no one can really agree. The bottom line is that you really should not be making a lot of immune cells to your thyroid. You should make almost none. Yes, you need a few to clean up some damaged tissue, but the more we look into this, probably the normal range is somewhere between below 5, maybe below 8, somewhere in there. But again, as Dr. Rutherford said, if you're at a 12 or you're at a 17 or you're at a 20 on your thyroid peroxidase antibody count, a lot of people are going to tell you that you're normal. In actuality, you really are not normal according to the new standard set forth by the Mayo Clinic. And some patients have a hard time discussing that with their doctor because, I mean, you're the patient, they're the doctor, they haven't heard of this, so it puts you in somewhat of a precarious position. But we've even given patients a printout from the Mayo Clinic saying, okay, anything below or above 9 is too high. So that way they could show their doctor so their doctor could kind of understand the methodology there. But you also have to realize, and it would probably be beneficial if you go on and watch our Hashimoto's broadcast, that there is still so much misinformation about Hashimoto's because most medical doctors, they have so much to be accountable for. And they're really looking at you from a perspective of, okay, are your thyroid hormones low? Yes or no? Do you have a nodule in your throat that makes them think that they need to check you for thyroid cancer? Yes or no? Those are the basic questions going through their head. And this whole issue of autoimmune thyroid disease in the presence of normal thyroid hormones is kind of maybe a little too much for them. Not too much like they can't understand it, but they just have too much going on, and that's not their world.
Right.
And so we go into that at length because so many of you have been told you're normal, right? You're normal. There's nothing wrong with you. But when we do the detailed testing, we find that you're not normal. And the research proves that you're not normal. So we wanted to kind of use this little snippet, so to speak, to really illustrate that lab tests can vary from lab to lab. You have to be aware of that. And you have to be judicious when you're looking at your labs so that you don't fall into the trap of just thinking, oh my gosh, my lab tests are normal again. Because so often that's not the case when we review the labs with the patient.
Yeah, so and the point of these keys to success is to help you to stay well. So you know, to piggyback on Dr. Gates's comment of you know, that's just not their thing. The Mayo Clinic puts out a communique every year that says we still don't know what to do with Hashimoto's thyroiditis. So
and subclinical hypothyroidism.
And they call it subclinical hypothyroidism, right? And so they're still struggling with the understanding that it's primarily a thyroid problem that you have to handle by dosing your medication properly, which, as most of you know who've been through this, it's not. But sometimes after you're for 2 or 3 or 4 years, after you've been out of here, you're doing well, and then maybe you go in there, somebody does a routine check. This is where I see this the most. Somebody does a routine check, you're feeling fine. You're feeling fine, and the doctor goes, whoa, we need to change your thyroid hormone. That's a red flag for a Hashimoto's patient. Or, you know, or if most of the time, that's what I hear. I was feeling fine, and my doctor told me that my lab ranges were off, and what do I do? Okay, what you do is you call us. You call us. One of the hardest things for me, and it's not as hard now as it used to be because Hashimoto's is now becoming at least embraced as a legitimate global diagnosis out there, even though a lot of doctors don't embrace it as far as to change their method of handling it. But if you go to the doctor and that happens, you need to call here and find out what's going on, because the hardest thing for me used to be to try to help the patient to understand, look, when your numbers are off, it's usually a reflection of other things going on in the system when you have Hashimoto's, and that you have to look for other things, that the Hashimoto's is kind of like the canary in the coal mine saying there's something wrong here, but it's not the coal mine. Okay, it's not the thyroid, it's other things. And that's not the model that is embraced yet in the medical model. So then if you go on and you try to like just use therapy, use thyroid medication for your therapy, that could create some big problems. Okay, so so basically, really, the one thing here is if you're feeling good, everything's right, you go get your annual checkup. They go, whoa, your thyroid hormones are way off, but you're feeling great. You're not getting heart palpitations. Your weight is good. Your hair is good. Everything's good. If you, and I would understand this, if you don't feel like you are able to deal with that, to communicate to your doctor, because it's an uncomfortable situation. The doctor's like, hey, I'm the doctor. Okay, you need to call Doc Gates, or you need to call us first to make an appointment, and get that cleared out. It might just be a matter of coming in and getting an understanding that you're okay. It might mean some other blood test to show you that you're okay. Because if your symptoms are good, you're probably going to be okay. Okay, so that's the thing I see that mostly throws people off a track. They come back in and they go, I went to another doctor, I had this, I took that, they put me on another diet, they did this, because maybe they read one thing about the paleo diet.
Or now they're taking you from your levothyroxine, putting you on Armour because it's more natural, and then your immune system starts attacking the Armour medication because it's animal thyroid. We've seen it a gazillion times.
Especially if you're feeling good, don't budge and call us first.
Yeah. Okay.
Yep.
So we'll see you next week for number 97. We're coming up on 100. We'll have a little party for that online. We'll see you next week.